Okay, again, good morning and welcome to our next installment at the Richmond Public Library. And I'm very excited to be sharing with you a topic that is very dear to my heart and is also something that I focus on in my practice, which is Alzheimer's disease and dementia, a naturopathic approach. So in this presentation, we're going to be talking a bit about what dementia really is, because there's some confusion and some misconceptions when it comes to the terminology of dementia. I mean, there's dementia, Alzheimer's dementia, Parkinson's dementia, and other terms, whether is Alzheimer's the same as dementia, is dementia the same as Alzheimer's, and so forth. Next, we're going to be talking about the underlying factors of dementia. So even though we have this as a so-called quote-unquote diagnosis, what really determines my treatments is really understanding the history of how a patient comes about, the testing that's involved, and then treating accordingly. So what I look for in my practice is more so not just if someone comes in and I diagnose them with X dementia, that it's always going to be the same exact treatment. In fact, my treatments vary from patient to patient, and thus dementia and Alzheimer's dementia can actually present very differently in a lot of people. And then at the end, we got some attendees looking for this, ways that you can really optimize your brain health and really reduce and mitigate your chances of developing dementia. Again, just a disclaimer that this presentation and the information is not intended to replace any medical advice or meant to be relied upon to treat, cure, or prevent any disease, illness, or medical condition. So even though I am making some suggestions and recommendations, it's best that you also bring this up with your medical doctor, naturopathic physician, or nurse practitioner. The attendance does not establish the patient-doctor relationship with me. So for those of you that are new to the talk and don't know me, my name is Dr. Romi Fung, and I am a practicing naturopathic physician at the Richmond Family Chiropractic in Richmond, British Columbia. I do hold a general practice, but have clinical focuses and interests in the treatment of Alzheimer's disease and dementia, as well as research interests. And speaking of research, I am embarking on a PhD in aging and health at Queen's University starting late next month. And I'm currently finishing my master's in aging and health, which will be done within the next few months, which I'm quite excited about. Also at Queen's University. I did my naturopathic medical training at the Canadian College of Naturopathic Medicine in Toronto, Ontario. And prior to that, did my pre-medical training at Simon Fraser University, doing a Bachelor's of Science in Health Sciences. So with all the training that I have, it gives me a really holistic approach to really understanding what each person is coming in for. And my path and my journey into naturopathic medicine really kind of jump-started when I've gotten kind of, I was born with quite a few things, went to see the doctor, and immediately, the moment I got a diagnosis or a label that I was given whatever treatment recommended, that was probably first on the list. And having been trained in the pharmaceutical sciences as well, naturopathic physicians in British Columbia, for the most part, are actually allowed, especially once you gain certification, in prescriptive authority. So I'm allowed to actually prescribe medications as needed. And having learned the medications, that I understand things do go in an algorithm. So whatever one patient comes in first, it's to start with this medication first and foremost, given that the risk factors and other factors that may not impede on this intervention take place? And if not, you go into the next level and so forth. And so one of the things that I've come to really, really become passionate about, not just regarding medication, but in regards to dementia, is after having worked with the seniors. And at this time, I've actually worked with seniors for pretty much 2 decades of my life, and seeing the um, kind of extent of how dementia affects the quality of life, daily living activities, and even families and communities. It's really almost harsh, and maybe even a pet peeve of mine, whenever I hear someone say that we're bound to get dementia. It's a natural part of aging. And part of me decided, I have to look into things that debunk this. And my research then got into something called the blue zones, which are areas in the world where people called the centenarians, people who live beyond 100, um, live in. And not all of them, not even many of them, are experiencing signs and symptoms of dementia. So is dementia really a sign, a natural sign of aging? Well, there is natural cognitive kind of decline and slowing down, but there are things where we will have to look into, and I do have some diagrams to show, but we will touch base on that. So first off, what is dementia? What is Alzheimer's? What is Parkinson's? And what is other things regarding this whole umbrella term of dementia? So dementia is more of an umbrella term where it does involve cognitive impairment and effects of the cognition. But there are many different forms of dementia, and the most common form is Alzheimer's disease. That takes up about 70 to 75% of all dementias that we see today. And so with that being said, the focus of this talk for the time being is mostly going to be about Alzheimer's disease. We do have a talk coming up on Parkinson's later on that I will also address as well. But when it comes to dementia, we get to this kind of state of normal aging where people do experience slight cognitive changes during aging. But it isn't until you get to a point where you hit down here where cognitive impairment really affects the everyday living quality of life and even interferes with your own capabilities of even being able to take a shower on your own, for example. So that's actually the point when one gets diagnosed with dementia. Now, if we just rewind that a bit to getting to something called MCI, or mild cognitive impairment, this is where someone, a loved one or a friend or an individual who starts seeing some cognitive changes, whether or not they might be forgetting their keys or their wallet, more often than not. And it's kind of becoming a little bit more concerning, even though they still are able to function in other ways. Some other people may not be able to calculate money, for example. So change, tips. Well, now that we're in COVID, everything is all digitalized and tap and such. So I don't think we have to worry too much about that. But to even understand a basic concept about money and numericals, that's definitely another sign. Planning ahead, if they're unable to plan ahead, well, is this happening more often or not? These are things that we look at, especially under the umbrella of mild cognitive impairment. Then there's something called preclinical or subjective cognitive impairment, SCI. And that's when you might start seeing some changes, whether or not that's like a slip of the tongue or even something that's on the tip of your tongue, but you can't seem to say, a word that you're trying to figure out. And it's just right there, but you just can't seem to think it. But other people may not even notice it. So these are signs and symptoms of what we call preclinical. And even through thorough testing, we might not even see detectable changes on lab tests or even scans. So that's why there's this quote here, a stage where the patient may know, but the doctor doesn't. And when it comes to any chronic disease, not just dementia, but diabetes, blood pressure, etc., the treatment success really relates on how early you catch it and how early you intervene. So when I think of Alzheimer's disease, and for the most part, most people, most research and most theories relate to something called amyloid plaque. And amyloid plaque is the kind of buildup of substance, something what we call plaque, that goes in the brain and kind of disrupts the function of the brain signaling and the brain neurons, so the brain cells. But when it comes to a holistic approach of Alzheimer's and dementia, I don't really just see it as plaque, even though that is a big component of Alzheimer's. I find it as just like any other tissue in the body. So you see in this picture here, a brick wall, and probably not in English, but to do with the building of bone. Our bones are constantly in a very fluid state of building and breaking down. We need to break down bone to get calcium to travel to other parts of the body, to quench inflammation and for muscle contractions. But of course, we need to build the bone back. So there's always this constant building and breaking. And it's this balance that is what we're trying to achieve. Something called homeostasis. If you've ever attended any science courses, high school science, etc. But if it becomes imbalanced in the bottom here, where you see this, I guess, troll face with the TNT about to destroy the whole bone, if you have too much breaking and not enough building, then things become problematic. And same happens when it comes to brain tissue, or what we call, we have brain tissue, but we also have something called synapses. And that's the end of the brain cells that allow brain cells to release chemicals to signal other cells. So it's this form of communication. And it's this synapse that is always constantly either being built or being destroyed. And this imbalance will then lead to cognitive decline. And so I use something called the Bredesen protocol, which is also part of my training. And under the Bredesen protocol, there's at least 36 factors that are identified that impact this building and this breaking. Something that Dr. Dale Bredesen has kind of brought up as having 36 holes in a roof. And if you have a lot of holes, that's going to affect, your quality of life living in this house, especially when it rains. And when it does rain, what would you prefer? Would you prefer covering one hole or as many holes as you can, maybe up to 36, to keep yourself and likely your families safe and dry? So attempting to fix just one will likely not solve the problem. And with the Bredesen protocol, there's this proposal that measuring all of these at a level of detail and actually addressing all of these, or as many of these as we can, is the goal that really affects cognition. So you're probably thinking 36 is a lot to really deal with. And it can potentially be. And that shows that there's so many factors that really impact not just our brain health, but our overall health. So out of these 36, the Bredesen protocol groups them into 6 groups called subtypes. And it's with these subtypes that then we can address a lot of these cases as a group. So the first one we talk about, type 1, is something called inflammation. And you've probably heard of inflammation in the form of physical inflammation or acute inflammation, where you bang your elbow on a chair or a wall and it starts to get red and it might even swell up. And that's because when it gets red, the body is trying to get more blood to flow in that area so that it can bring in the nutrients that the injury needs to repair itself and to get more lymph and more fluid flowing in there, hence the swelling, to remove some of the toxins and also whatever infections that potentially did happen in that location. But when we think about inflammation, we typically think about chronic inflammation. And that has to do more with a lot of our vasculature and systemic, so our whole body's worth of inflammation. And how does our body get chronically inflamed in the first place? Well, there are many things that can potentiate and contribute to that. Our diet, for example, sugar being the most inflammatory of foods, and having, for example, for those who are diabetic, they have a lot more of the blood sugar, blood glucose that's in their blood, and that could lead to a lot of things that happen downstream. And why does that happen? Well, sugar can bind to protein. I believe specifically to the amino acid proline. But what that means is if a sugar binds to a protein, it'll never be reversed. Once it's bound for life. And so if it's bound for life, something that we call glycation, the body can only remove it by destroying it. And in order to destroy it, it has to recruit the immune system. And in order to recruit the immune system, you need to bring in inflammation to get the swelling going and the blood flowing. So when one gets diabetes, what's the first thing or first couple things that doctors tend to kind of monitor when one gets to a chronic state of diabetes? First thing is typically their eyesight, because the eyes hold the smallest vessels in the body, and thus having such small vessels in a pretty crucial organ, well, these small vessels are typically first to go, because once you destroy the small vessels, there's not really much else. And so that's why a lot of diabetics are being monitored for their eyesight in the case of diabetic retinopathy or blindness due to diabetes. The other part would be to do with the feet or the limbs. You probably have seen some pictures or some gruesome pictures of patients who've had long-standing chronic diabetes having to have their feet amputated because the feet has festered and such. So those are things that are linked to that inflammation coming from sugar. But there are also other forms of or sources of inflammation that we will also address later on. But lack of sleep is also quite inflammatory. Lack of physical activity. Oops. Second is hormones. So when we think of hormones, we probably think of estrogen, testosterone, progesterone, and so forth. And for good reason. There is a link where women are more at risk of developing dementia. And the theory behind it is because once they've reached menopause, that they're not necessarily producing the amount of estrogen as they used to. But for men, uh, men actually do produce a tiny bit of estrogen for the entire span of the life, and that has been found to be also protective for the brain. So optimizing hormones can also mean something protective for the brain health. Uh, you might have you might know someone with a low functioning thyroid, for example, or hypothyroid, and they have to be supplementing synthroid or thyroid medications. And there has been findings where you have low thyroid function leading to low energy, low metabolism, weight gain. Weight gain can also be very inflammatory. That could be a secondary kind of contributor when it comes to hormones. But also, a lot of people with low functioning thyroid might also might also observe brain fog and um, something that might be very similar to um, the slowing down of the brain or brain decline or cognitive decline. And so this is where we're starting to see that hormones actually do play a role in our brain health. Now, something in between inflammation and hormones is what I just brought up under inflammation, glycotoxicity, or too much sugar. And I just kind of talked about that in the inflammation, but having too much sugar can be really damaging to the blood vessels, thus having to recruit the immune system, leading to that increased amount of inflammation. And there's a lot of kind of studies, mostly on rats at this time being, where by having more systemic or full body inflammation, that chances are the brain is also inflamed. And if the brain is inflamed, then there's something called the blood-brain barrier, which is the protective barrier of the brain that protects the brain from almost everything. And a lot of pharmaceutical companies do a lot of research to find out how certain drugs can get into the brain. And right now, there's only a very few that can. But if the brain gets inflamed, then the blood-brain barrier becomes a bit more porous, and that allows for a lot of things to enter when it shouldn't be entering, causing damage and causing the body to say, there's something going on in the brain. We need to recruit, immune cells to really investigate and clear it out. The next up, we have heavy metals. And there are two sides of heavy metals. There's been a lot of media in the past decade talking about how mercury can cause, quote unquote, I'm not really too familiar or too sure about the terminology here, but that can contribute to um, cognitive decline. And it's been found that certain metals and certain toxins, such as mold, can affect the synapses, so the brain cells. And we talked just briefly earlier that it's about this balance of the brain cells that we need, just like the balance of everything else in the body. And so heavy metals actually can disrupt that balance. That's the point right there. Then there's two other categories that are not as common, but can also contribute to dementia and potentially Alzheimer's. One is vascular. So this is your blood vessels. And if you think of blood vessels in the brain, you're probably thinking of stroke. And some people can actually observe symptoms of dementia and Alzheimer's if the area of the stroke, what the stroke affected, happens to be the part of the brain that has to do with the short-term memories, the hippocampus, for example. And so that is one thing. And then next and last is trauma. if anyone has had a history of concussions, then they probably have seen symptoms of brain fog, or they can't really focus as much, besides having debilitating fatigue. And that's probably because once the brain is in a state of shock, it needs to have more nutrients to kind of rebalance that and to almost even calm it down. Because once you're in trauma, just like when you're in stress, you put yourself into a fight or flight response, the sympathetic response. And that's where your body thinks there's a threat going on and it has to protect you and have you survive. And so by not being on the parasympathetic, the rest or digest, your body's not going to be able to give a chance, or you're not giving your body an opportunity to recuperate and recover. So when it comes to the subtypes here, we group them further on to 3, because these 3 are the most common subtypes that a lot of doctors will see in their practices, being inflammatory, atropic meaning hormones, and toxic. And so there are some things to consider when it comes to treatments. For example, when you're having, an inflammatory response in the top left, you want to make sure that you're removing foods that might be inflammatory to the body. So sugars, gluten, and dairy, especially A1 from A1 cows. And other foods, such as food sensitivities, can also be inflammatory too. So this is where we have to incorporate the diet and the lifestyle, and incorporating and including foods that are anti-inflammatory. So these things might be, omega-3 coming from fish, quercetin coming from fruits and vegetables, turmeric, which was part of my study, coming from curry. Those are foods that are anti-inflammatory, for example. But also incorporating knowing that if we have to balance the blood sugar levels, it's not just about blood sugar we have to worry about, it's about insulin. And insulin is our hormone that really controls our blood sugar levels. And if insulin becomes resistant, that our blood sugar levels are not going to be as mediated or regulated. In the middle here, you see homocysteine. And homocysteine is really a measure of cardiovascular disease, something that a lot of doctors would measure to see the extent of cardiovascular disease, and we would supplement accordingly. Now, looking at the top right, atropic or hormones, we want to make sure that your body is producing proper levels of hormones and even utilizing those hormones. So vitamin D is also really good. Exercise, stress management. I mean, if your body is going through fight or flight or sympathetic, it's not going to be wanting to produce estrogen, testosterone as much as it would cortisol. And that's something what we call the pregnenolone steal. When your body is stressed, it's not going to want to give the resources to the estrogen and testosterone. In fact, it's going to want to take that and start making cortisol, which is the stress hormone, for you to be pumping your blood faster and getting more oxygenated blood in the muscles, so that you're able to flee from whatever threat that is what your body thinks is encountering. And then at the bottom here, toxins, looking into making sure that your body's own capabilities of removing toxins, i.e. the liver, is supported, and getting rid of or chelating heavy metals, and looking for if there are any signs and symptoms of mold infestations, etc., is also very crucial in this case. So how I would approach my practice in treating dementia, of course, the first and foremost is the initial. And with my initials, I tend to spend 2 hours with patients coming in for dementia work because it's really about understanding how it developed for me and knowing how it developed and the signs and symptoms, because it's not just memory loss. And I didn't quite define, dementia and Alzheimer's, but when it comes to cognition, there are different aspects of brain function and such. There's planning and organizing, there's language, there's spatial, meaning the space it takes for you to go around, and understanding, being able to draw three-dimensional figures is also part of being spatial, the spatial visual. Calculations when it comes to money, we've mentioned short-term memory, and even understanding where you are in time and space. So in my first 2 hours, I would spend a lot of time really getting to understand that, and then getting the patient to do a couple of objective testing to give me a sense as to which parts of the brain are functioning and which parts are not. And then that's where I really start thinking about what aspects, looking at the subtypes and also even just the body itself, what aspects of their health is compromised and how. And so physical exams and even lab testing, something that I also do in my practice, is something that is very crucial and gives me a better understanding as to how I can approach my cases in dementia. And in my toolbox from there, once we understand what's going on, this is where I can intervene and start really incorporating a holistic approach to dementia, whether that be through nutrition and supplementation. If we know that you are lacking certain nutrients or needing more nutrients to combat stressors and to help build the brain, then that's something that we will go for. That also happens with herbs. Herbs also have a very powerful effect on nutrition. And there are also herbs that you might have heard of out there that can help with brain function. Acupuncture is something that I also do quite fondly, and not just for stress relief, but for organ systems that may be imbalanced. If your digestion or hormones is imbalanced, I find that acupuncture is also quite effective. And so is Bowen therapy. And for those that don't know what Bowen therapy is, it's a type of very gentle manipulation, almost like a body work, but not necessarily a massage. And I do not challenge the muscles, but in fact, I challenge the fascia, which is overlying the muscle, almost like a cling wrap, the plastic wrap that you use to wrap food and such. Every muscle has some sort of fascia to wrap it so that it gets its shape. And so it's not really relaxing the muscle to gain the flexibility, it's about working on the fascia. And fascia is also quite metabolically active. So what that means is, in order for the body to communicate with the muscles and vice versa, it has to be through the fascia. And so by working on the fascia, the signal then can actually be sent to the brain to instill a form of relaxation and getting on into the parasympathetic state. And that's where healing and recovery takes place. And that's something I also do quite a lot in my practice. And not just for pain and such, but I've seen some interesting effects with shoulder injuries and mental health too. And lifestyle medicine is probably the number one thing that I need to emphasize, because it's not really about the time that you spend in my practice that's important. Of course, to understand what we have to do, yes, but most of the action is going to be dependent by you or by the patient. And that's in between the visits. And that's what you do on, a daily basis. And we're finding that a lot of simple things, especially when it comes to reducing the risk of dementia, has to come from what you do on a daily basis. Because my saying here is, if you're not, eating right, sleeping right, moving right, pooping right, and so forth, then chances are you're going to have that imbalance somewhere. And if that chronically builds up, well, signs and symptoms will show up. So one of the treatments that I utilize was part of actually my research that I did through Queen's University on the efficacy of curcumin on the treatment of Alzheimer's disease. And this was a review study. I've compounded 7 studies into this and really found that, of course, there's a need for more evidence when it comes to curcumin coming from turmeric, which is curry. There's a need for more standardized studies. And what I mean is, just like with nutrition and with supplements that anyone can recommend, I have to take into consideration other things. So what does that mean? Well, if one tells you, oh, take curcumin, it's going to help with, your memory and your brain health. Well, if that's coming from a friend, a family member, etc., you're probably going to take it right away, run to the health food store and get a bottle of curcumin and start taking it. But there's more to it than that. How much of curcumin are you supposed to take? And what forms of curcumin are you supposed to take that is most ideal? Because chances are that most curcumin supplements that you find in the store, your body's not going to be absorbing. It's going to stay in the gut and you're just going to poop it out. And even though there are actually good things about that, I'm not saying it's bad, but I'm saying is, if you want to work with the brain and curcumin, that's probably the most unreliable type of curcumin we want to be utilizing. But if you have digestive concerns that are inflammatory in nature, whether that be irritable bowel syndrome or inflammatory bowel disease, then that may be something that's more ideal. So it's really about the context. And what I found through this study is that some studies showed that curcumin did help with improving memory scores, and some didn't. But each study had their own different form of curcumin, and only one of the 7 studies used a form that showed research that actually not only did the body absorb, but got through the blood-brain barrier that we were talking about. So what I'm trying to say is, this is also something I'm going to be bringing up in a future talk on supplements, truths, and myths. But you really need to understand what you're taking first and foremost, because there are risks involved in taking such supplements. And this is where someone like myself, a naturopathic physician, is trained to really understand what works and what doesn't work based on your context or the patient's context. Because there are also supplements that might really involve or interact with your medications, for example. The last thing I want to do is to give my patient curcumin if they're on a blood thinner. Even though I know curcumin may have a mild blood thinning action, I need to be talking with their medical doctor and making sure that the patient is getting tested to ensure that their blood clotting function is still being maintained. So this is where kind of that working with your medical doctor is something that I'm also very big on, collaboration. So when it comes to lab testing, there's a lot of labs that can really tell me the function of, the body and the brain. So I do have access to life labs just like any other medical doctor. But besides the testing, I also use a lot of functional testing. And what I mean by functional testing is how the body works and how the body is kind of working. So one of these tests is heavy metals and mineral testing. So I can actually figure out whether through hair or urine more accurate, how much of the heavy metals your body's actually holding on to. Because most heavy metals are fat soluble, meaning they stay in fat tissue or adipose tissue. And it stays there for quite some time. And it even stays longer, or you contain more if you contain more of the fat tissue. So that's something that we can test as naturopathic physicians. Another test that I'm quite fond of is the omega-3 testing. We know that omega-3 is very protective to the brain. And there are there are two components of omega-3 that we look into. Something called EPA and DHA. You probably have seen that on the labels. But EPA has this anti-inflammatory component, and DHA has to do with the building block of the brain, or building the synapses of the brain. And again, with supplements, a lot of supplements will suggest you taking one a day. But I actually encountered some patients. I'm not going to say brands, and I'm not going to say specific supplements here for the sake of this presentation, but I had them say, oh, I'm already taking a fish oil omega-3 supplement. And I said, cool, how much? Well, the label tells me one a day, so I think I'm doing fine with omega-3. That's when I asked the patient, could you show me the bottle or the label? And when I looked at it, I had to say this to them, and I quote, to get the most ideal and optimal dose with this supplement alone, you're going to have to take about 30 of these capsules daily. So it's really a matter of understanding a proper optimal dose. And that not only goes by weight, but also, based on the severity and other sources of food, diet, etc. Of course, if you're eating more fatty fish like salmon, mackerel, sardines, that's also really good too, and that contains omega-3s. We also have access to something called organic acids testing, which is a urine test. And that could tell me a lot about the pathways and the functions of the body. Here you see some of the nutritional markers. So we can measure for B12, B6, B5, B2, vitamin C, CoQ10, and so forth, just through a simple urine testing. So with that being said on my approach, I'd like to share a few things that some of my patients have come in for, and this is something that we have to do, because one thing for sure is that lifestyle is going to be something that you do on a daily basis, and that's probably one of the most powerful medicines that you could be doing at this time. And that if you aren't really, eating well, sleeping well, pooping well, moving well, chances are whatever your doctor or me, the naturopathic physician, or other naturopathic physicians are doing, if you're not doing those things well, chances are whatever we recommend may not be as effective. Because if you're not pooping well, for example, you might not be excreting whatever you're consuming. And if it stays in the body, well, the effects then become a little different. Same thing when it comes to urinating. So if you're not drinking enough water and you're not urinating well, it tends to concentrate. And if the water doesn't flow around the body as well, maybe due to lack of movement, well, that's also another thing. so many factors to think about here. But what can you do now? There's something called brain-derived neurotrophic factor, BDNF. And BDNF is what we call the miracle grow for your brain. By increasing the BDNF, it really helps build the brain cells and maintain them too. So this is something that you probably already are doing. You just don't know. And I'm here to remind you, and with the research, that it shows that these simple tips will actually increase your level of BDNF. And based on our current lifestyle situation, most of us are not really doing these things. What am I talking about? Well, first off, exercise. Exercise is probably the #1 lifestyle habit to help increase the function of the brain. You probably find people who are more physically active that have a really sharp mind and a sharp brain. And this involves not just aerobic training, but also resistance training too. So it's really good to have a good balance of both. So even if you're doing, ideally, like they say, 30 minutes minimum of somewhat moderate physical activity is very ideal. And the more the better, but not too much either, because you don't want to be stressing your body too much. So I say 30 minutes to an hour on most days of the week. Let's say 4 to 5 days minimum. But yeah, those are found. This is what am I thinking here? It's this exercise that really builds up the BDNF, and that causes brain cells to grow. But exercise also has a lot of other benefits that can help with dementia too, such as the fact that you're moving and exercising also puts your body in a less inflamed state. And we mentioned briefly that inflammation, especially when it comes to the whole body inflammation that affects the brain, alleviating this inflammation can really reduce the burden that's on the blood-brain barrier. And many other things too. Exercise also increases dopamine and serotonin. These are our feel-good hormones. So our functionality of the brain gets improved. Exercise also builds and keeps other transmitters and other signals in the brain to go. So like GABA, which is very calming. You can even find that as a supplement. And it's probably even more effective than antidepressants. I mean, with the society today, are we exercising enough? And is that impacting on our health? Second is stress. And I'm going to just use the meditation as an example here, but people under stress produce a lot less BDNF. That's probably the reason why, when you're stressed, that you probably couldn't think clearly. And that there's decades of research right now linking to meditation and health outcomes. With the society today, are we stressing too much? I'm saying that to myself as a graduate and doctoral student too, but thirdly, sleep. Sleep has a big component to BDNF. And decades ago, we were probably sleeping about 8 to 9 hours on average. And now we're going down to about, for the adults at least, 6 to 7 hours on average a night. But not just BDNF, but there was one study with about 30-ish people done in, what am I thinking here, 2018. Yeah, 2018. So quite recent actually. What they did was they got participants to be to either sleep or be refrained from sleeping. And then they were able to find a tracer, and that tracer could bind to amyloid, and then they could image. So using brain imaging, find out how much beta amyloid is being produced in these people. And what the researchers really found was after a day of no sleep, so about 24, 30 hours, that these participants, compared to those who were sleeping regularly, the participants that did not get the sleep actually increased their beta amyloid by about 5%. And that's quite significant just after one night of sleep. And so sleep is also going to be very important. It's also something that, if it's something we need to work on, that's also something that a naturopathic doctor or your medical doctor can provide as well. And finding ways to not just, getting a pill to helping sleep, but working on your sleep hygiene and really understanding that the body is habitual, in a sense that it needs to get the right signals to fall asleep and to stay asleep. People who are, waking up or feel like they're very light sleepers can also potentially because their stress is keeping them in a very light state. And so this is where we might even start testing adrenal function to see if your body is producing the stress hormone and cortisol while you're sleeping, when you should not be producing as much. Nutrition is also going to be one thing, but not just specifically nutrition, or specific to nutrition, polyphenols and antioxidants. These reduce the damage and the stress or oxidative stress that happens in the body, reducing the burden, and can potentially reduce the burden on other parts of the body so that the functionality could occur. It's kind of like the body can't really do everything at once. And thus, if it has to focus on one thing, and that thing is very, very big, such as, threat and stress, that the body's going to reallocate other resources to ensure that it addresses it before it addresses other things. Sunlight is also very big in BDNF. And right now we're coming into a time in our life where a lot of us are avoiding the sun and are afraid of skin cancer. But the sun really does provide not just the vitamin D, but the signals for the body to go through its own natural circadian rhythm. And we talk about the circadian rhythm in one of our very first talks in COVID. But circadian rhythm is not just to do with the sleep. It makes sense with sleep, but other aspects of our functionality of our body, our physiology, happens optimally at different times of the day. That's probably why you don't want to be eating right before bed, for example, because your body is already set thinking, oh, it's time to sleep. We don't need to be digesting at that time. And then your digestion gets either affected and such. If you start eating before bed, blood sugar levels go skyrocketing up too, because your body is not really equipped to wanting to secrete insulin as much while you're sleeping. That's also why our bodies have a tendency to wake up in the morning, not just because it's the morning, but by knowing that it's the morning, it spikes up the stress hormone to wake us up. And so if that stress hormone is kind of left on the higher side of things during sleep, you're not really getting into the deep sleep, and the body's thinking that it has to wake up at, some point very soon. We talked about fasting a couple weeks ago, but fasting also, besides working with the blood sugar levels and so forth, also has a really big effect on the BDNF. Maybe because by giving a body a chance to digest, but not having to reallocate resources, the body can then work on other parts of the body rather than digesting almost 24/7. So this is where, just like what I like to term cognoscopy, you've probably heard of colonoscopy, where you have your doctor view your colon on a basis to ensure that you don't have any signs of colon cancer. Just as individuals are advised to get a colonoscopy when you turn 50, uh, Dr. Bredesen and many doctors like myself really like to start proposing something called a cognoscopy, or something to at least check your brain function based on your body function. So this is where we start taking blood tests to really ensure that the body is working well, measuring, your vitamins, B6, B12, vitamin D, vitamin E, looking at your insulin and your blood sugar levels and heavy metals, etc., but also ensuring that your lifestyle habits are also optimal. So sleep apnea, digestive and gut health, inflammation, because all of these factors really can contribute to a decline in cognitive function. So really understanding that, identifying the root cause, which is one of the biggest principles of naturopathic medicine, and root cause of these inflammatory components, etc., so that we can really find and define effective treatments. So to summarize, dementia really takes on many forms, and that we've learned that it's not just one, but at least 36 different factors that underlie Alzheimer's disease. Now learned a few things that we need to be looking at that really give us the best bang for our buck when it comes to our cognition and our cognitive health. And that's why it's also best to take that preventative approach, not just for your brain health, but also for your health. And that concludes my talk right there. Any questions, comments, and or feedback, bring them up to the chat box. And before I end right here, and before I say thank you, um, for those that are new to the talks here, you can follow me on social media. I have like me on Facebook, follow me on Instagram, as well as my YouTube channel. I also provide a lot of health tips, health information, and even opportunities for future talks like this through my Facebook and Instagram. And so you'll be given notifications about when the next events are, and also the information about registering and such. I also do posts about certain aspects of health and just general health, etc. And you can find me by searching Dr. Romi Fung ND. You can also find me at my website at www.drromifungnd.com. And if you have any questions after the talk that you would like to inquire about, you're also more than welcome to contact me at contact@drromifungnd.com. I'm going to stop right here.